టైం నిజాం ఇన్స్టిట్యూట్ ఆఫ్ మెడికల్ సైన్సెస్లో చేస్తుంది. సో దీనివల్ల వీఆర్ ట్రైనింగ్ అవర్ నర్సెస్, యంగర్ నర్సెస్ యాజ్ వెల్ యాజ్ ట్రైనీస్. అంటే కొత్తగా చదువుకునే వాళ్ళు, బిఎస్సీ నర్సింగ్ చేసే వాళ్ళకి ట్రైనింగ్, అలాగే ఒక మాడ్యూల్ కాదు, అలాగే బయట మా ఇన్స్టిట్యూషన్లోనే పనిచేసే నర్సెస్కి కానీ ట్రైనింగ్ ఇస్తున్నారు. సో దీనివల్ల అడ్వాంటేజెస్ ఏంటంటే ఈ ట్రైనింగ్ వల్ల మన నాలెడ్జ్ పెంచుకోవటం. ఈ మధ్య మీకు అందరికీ తెలిసే ఉంది, చాలా ఎక్విప్మెంట్ వస్తుంది. సో దానివల్ల మనం వీ హ్యావ్ టు అప్గ్రేడ్ అవర్ సెల్స్ న్యూ టెక్నాలజీ. ఎక్విప్మెంట్ వస్తుంది, దానికి అనుగుణంగా మన నాలెడ్జ్ని పెంచుకోవటం, అలాగే నాలెడ్జ్ని డిసిమినేట్ చేయడం, వేరే వాళ్ళకి నేర్పించడం, ఇవన్నీ చేయగలుగుతాం. సో ఇది కనిష్టం అంటే నెల 5 రోజుల పాటు ఈ ట్రైనింగ్ ప్రోగ్రామ్ అనేది నడుస్తుంది. ఎక్కడ ఇన్ని రోజులు ట్రైనింగ్ ప్రోగ్రామ్ ఎక్కడ ఉండదండి. ఫస్ట్ టైం మనం కండక్ట్ చేస్తాం. దీంట్లో ప్రతి ఒక్కరూ రావచ్చు. ప్రతి ఒక్కరూ అంటే బయట ఉండే నర్సెస్, బయట గవర్నమెంట్ హాస్పిటల్స్ కానీ ప్రైవేట్ హాస్పిటల్స్ కానీ వాళ్ళ నర్సెస్ కానీ వచ్చి ట్రైనింగ్ తీసుకొచ్చి దీనికి కొన్ని పాయింట్స్ అని ఇస్తాము. అంటే ఆ పాయింట్స్ వల్ల, క్రెడిట్ పాయింట్స్ వల్ల వాళ్ళకి ఏంటంటే ఫ్యూచర్లో ఎక్కడైనా జాబ్ ఆపర్చునిటీస్ కానీ బాగుంటాయి. సో అందువల్ల ఈ ట్రైనింగ్ చేస్తున్నాం. సో నిమ్స్లో సిస్టర్స్కి ఆల్సో వీఆర్ ట్రైనింగ్. సో బేసికలీ టు అప్గ్రేడ్ దేర్ నాలెడ్జ్, వాళ్ళ నాలెడ్జ్ని కొంచెం పెంచడానికి. ఆర్ ఎయిమ్ ఈస్ టు మేక్ దెమ్ ఆన్ పార్ విత్ డాక్టర్స్. అంటే డాక్టర్స్ ఎంత నాలెడ్జ్ ఉందో వాళ్ళ నర్సెస్ కానీ అంత నాలెడ్జబుల్గా చేద్దామని ఈరోజు ఈ నర్సింగ్ ట్రైనింగ్ స్టార్ట్ చేసాం. ఇది ఒకరోజు కాదు, ప్రతిరోజు 2 hours ఆల్మోస్ట్ 1 days వరకు.
Everyone present here, respected director sir, dean madam, faculty and all the nursing staff. I hope you are all having a very wonderful day. I'm Dr. Suprasha, a resident of hospital administration. I would like to start the program with a quote. When you are a nurse, you know that every day you will touch a life and a life will touch yours. I'm honored to address you all today. I would like to welcome our dignitaries, Dr. Birappa sir, onto the stage, Director of Nims. Dr. Lisa Rajshekar Madam, Dean of Nims. Dr. Nageshwara sir, Associate Dean of Nims. Dr. Swarnalata Madam, HOD of Nephrology. Dr. Lakshmi Bhaskar sir, Additional Superintendent. Mrs. Padma Madam, Nursing Superintendent. Mrs. Dakshayani Madam, Principal of Nursing College. I would like to call all the dignitaries to light the lamp. I would like to call Dr.
Birappa and my dear nursing staff. It's been overwhelming response. Initially, when I thought of this program, so I was little apprehensive, but it was, I think, Director Sir who has encouraged me, and so I said it is very much required because as doctors we try to attend so many conferences and we upgrade our knowledge. But as a nursing staff, I think you have been, you have learned this during your training period, in the early training period. Subsequently, there is no such what you call updation or the conferences, so that you have an opportunity to upgrade yourself. So I think this is a very good opportunity, and with the help of Director Sir, I think we are now, today we are gathering here to inaugurate this session. And it's been a 5 weeks program, extensively, covering and all the aspects which a nursing staff should know, the basic things which a nursing staff should know. This is the initial attempt. I think all of you can, go through this, and as we travel this training program, we'll get to know what are the issues which need to be covered or which need to be actually added into this program, and try to customize as per your feedback. So don't worry, this is all our program to upgrade ourselves and to ultimately improve the patient care. So I welcome you all, and I'm very happy to see all of you here. And I think people are still joining. We had 160 registration. I think I had to stop 20 registration because I was a little apprehensive whether we can accommodate so many. That's the reason why at 20 I put it pending. So if you are okay, I think I can also, we can welcome everybody, and make sure that you attend all the classes. Only then you will be given, we have applied for the Telangana State Nursing the Council also, will be getting these credit hours. So they also will try to come here. They said they will be attending each and every session, and they'll see how it is going on. They have promised to give 2 credit points to each of these sections. So we have around 5 to 6 sections. So we'll be getting almost 12 to 15 credit hours. So it will be very useful for you in future also, and attend all the classes and enjoy the journey of learning process. And I welcome you once again, and hopefully this will be beneficial to all of you. Thank you, sir, for giving the platform, to have such a great session, innovative session for nursing care. Say a few words.
Good afternoon, respected Dean, Dr. Lisa Madam, Professor Maheshwar Rao, Associate Dean, Dr. Padmaja, Associate Dean, and Padma, Matron, Principal Garu, Principal of Nursing, Lakshmi Bhaskar, Deputy Medical Superintendent, dear sisters, and media and friends. Thank you very much, Swarnalata. The instrument, the person behind this program is Dr. Swarnalata. A big applause for her. She has taken a lot of pains in preparing the list of topics, and she has spoken to many people. In fact, she has spoken to the Honorable Health Minister also. He was so happy. And today we have around 160 registrations. I am sure after 2-3 weeks it's going to be much more. This journey is going to start from Nizams. It's going to extend to entire Telangana. All the nurses in Telangana, whether they are working in a government institution or non-government institution, they'll get trained from Nizam Institute of Medical Sciences. That much assurance we have right now. So thank you for all. And the reason why we thought of having a nurses training is not that you are not having a knowledge. So we go to all the doctors, as Swarnalata rightly pointed out. We go to many conferences. It's not to just enjoy or see the people or see the places. We try to learn, keep on learning. So we must have attended so many conferences, we must have delivered so many lectures. Every time we learn definitely something new. So we should not stagnate at one level. We keep on upgrade ourselves because the technology is improving, the equipment is improving. You must have seen when you are training some equipment, and now the kind of equipment we are getting, all advanced equipment. For example, robo. The nurse, the in-charge nurse who's there, she had gone to the Kochi, she cleared the exam and she has come, she's training others. So that's how the training would be. So we need to upgrade ourselves, and you are the better person. You are going to teach some of the staff of nursing college. you are going to teach your students. So upgradation of the knowledge is very, very important right now. Ours is not like any other hospital, district hospital or PHC. This is a teaching institution. It means we have to upgrade our knowledge then and there itself, or as the equipment comes. We are all happy with the kind of services you are doing. So that does not mean that we should not upgrade. We have to upgrade. There are certain things we need to discuss openly and then excel. So thank you very much for giving this opportunity. It's going to be a very successful program, I'm sure. Don't be anxious. That's Swarnalata. It's going to be one of the best programs, I'll tell you now itself. Thank you very much for giving this opportunity.
I would like to call Dr. Lisa Rashika ma'am to say a few words.
Good afternoon, everybody. And good afternoon to all the delegates on the stage. I mean, each one of them is here. Each one of them is known to us, and we know the many years of hard work and dedication of those people who are here on stage. But what gives me more excitement is the faces that I am seeing in front of me. Dr. Swarnalata, thank you very much. I was also apprehensive about this program because in the few weeks that I have been dean, Dr. Swarna came up with this challenge that she's going to have a program for teaching nurses. Now we all know that the last 2 years, 3 years during COVID, all of us got together in small groups to learn new things so that we could deliver the care which the world has provided us in terms of vaccines, in terms of intensive care. We all grouped, learned and gave it to the patients. And this initiative that we want to formally have educational activity going on for nurses is the result of a long felt need. I'm sure you all are happy to be here and will continue to be happy over the next few weeks that you'll be here. Welcome you all.
I would like to call Mrs. Padma Matron to say a few words.
Respected Director Sir and all dignitaries Sir, good afternoon Sir. Sir, మాకు ఒక మంచి అవకాశంగా భావిస్తున్నాం సార్. ఇప్పుడు ఇన్ని రోజుల తర్వాత నర్సెస్ ట్రైనింగ్ ప్రోగ్రామ్ డ్యూటీ డిస్టర్బ్ అవ్వకుండా అందరూ ఇది కవర్ అవ్వాలి, అందరూ నేర్చుకోవాలని చెప్పేసి ఇంకా సార్ థ్యాంక్ యూ సార్. లత మేడం ఇవన్నీ అయిన తర్వాత మేడం చెప్పారు, మొత్తం అందరూ అయిన తర్వాత ఈ ప్రోగ్రామ్ కంటిన్యూ చేస్తామని. థ్యాంక్ యూ సార్. థ్యాంక్ యూ.
I would like to call Dakshayani Madam, Principal of Nursing, to say a few words.
Good afternoon, Director Sir, Dr. Veerappa garu, and other dignitaries and dayas. Good afternoon to each and everyone. Sir, we are very happy to be participants in this program. We are highly thankful for starting this continuing of nursing education to the nurses who are working in Nims. So once upon a time, nurses are just caregivers. Now the role of nurses are expanded. So now this is the right time to update their knowledge and skills. So in order to update their knowledge and skills, this type of training programs are highly useful. And the most important thing is, sir, as we also nurses, we are interested to attend for continuing education, not only in-house. And our nurses are interested to attend the programs conducted in other places. So here I am requesting our director sir to give special leave to sponsor our nurses also to attend for training programs organized in other institutions. And we are highly thankful to Dr. Swarnalata Madam for taking initiation, and Madam conducted so many discussions for coming and for organizing this program. And once again I am thankful for the interest Sir has taken and other people they have taken in organizing these programs. Once again I am requesting all the nurses who are working in the Nims to use these services. Not only these, if you have any learning needs, Madam is readily, she will plan for the future programs. Thank you.
Good afternoon, everyone. Good afternoon to the dignitaries on the stage. I first of all thanks for the directors of Birappa sir and Deans Lisa madam and Superintendent sir for giving an opportunity for us to conduct this program. And so this program was initially started for upskilling and retraining of the nursing staff, and we are thankful for them for giving this opportunity as it improves the patient management and rehabilitation care. So we hope that all the sisters utilize this program to the fullest of their potential. We also thank the speakers who are finding time in their busy schedule to train our staff and upgrade them. We are very thankful to the organizing committee for coming up with this brilliant idea and putting it in action. We hope that this training module will bridge the gap between the patient and the nursing staff and improve the patient care, as this is the main goal of our profession. I thank all the other coordinators for their dedicated continuous support, and I also thank the God Almighty for making this program possible. Thank you.
Now we would like to start the session with the role of nursing care in patient management by Dr.
I'm sure everything you know about. There is nothing new in this. But I would like to say a few words, being a head of the institution. I request you, don't consider this as a great lecture. This is only some of the views I'm just putting in front of you. I know most of our nursing staff much knowledgeable than outsiders. I know that from the beginning. From the day when which I entered Nizam Institute of Medical Sciences, I said, you are the best nurses I've been seeing in this institution. Because I had seen in the district hospital where I was trained, the nurses were not very good. So they were not trained properly. But here, I'm sure, I'm definitely very much aware that you are much better than any sisters in outside the hospital. Let me see some of the things. Can I have a mic on that? Mic on that. So round the clock, some of the general roles are round the clock nursing services. As I already once mentioned that we the physicians or surgeons will go and see the patient and then give instructions and go. But it's the nurse who stays with the patient. You have more interaction with the patient. You are interacting with the attenders, so you know better their problems are. They can be more affectionate with you. They may not affectionate with a doctor. I will spend 15 minutes, maximum 10 minutes. How much time I'll spend in a OP to see a patient? 10 minutes, 15 minutes. And I might operate when patient is under anesthesia. You will not know who is operating. And after the surgery, I'll explain them 10-15 minutes. But the nurse, the brother, are going to stay with the patient and explaining them everything. You are giving an emotional support. You are giving a lot of support to the patient and attenders. So your duty is always appreciable than a surgeon's duty. And I know that you all monitor, you coordinate with doctors. That is most important. That's where I feel some of the junior nurses, they fear to talk to the doctors. They should not. In fact, if you go to any other countries, the doctor will speak with the, nurse will speak with the doctor like in a doctor. They always see on par with the doctors. Similarly, doctors also see nurse on par in their knowledge. Nurse should not be having a less knowledge than a doctor. Only degrees are different. Degrees are different. Otherwise, you are on par with a doctor. So you should know. I am sure you are all quite aware of monitors.
you'll be seeing the monitors, you know how much is the pulse rate, how much is the BP, how much is all those things. So assisting medical personnel, suppose if there's something wrong with some bradycardia, you realize that patient has a bradycardia, you realize that patient has a less heart rate, and then inform immediately to the doctor. And some of the nurses, I'm sure some of them I've seen in emergency medicine, even giving in drugs to decrease the heart rate. That's good. You need to tackle in emergency. You cannot sit ideally and then keep calling a doctor. You have to treat it. That should be the training. So housekeeping is also part of our job, your job. So it involves maintenance of a clean environment around us. That gives, in a very very good impression for the patient. The area should be clean, safe, and comfortable environment. Suppose we have done a major surgery and patient is in ICCU, and what he needs is a calmness. He really wants to sleep, or if somebody is creeping, somebody is crying, and some sound is going around, they may feel very uncomfortable. So it's our duty to see that the surrounding environment is clean, safe, and noiseless. There should be place for everything, and everything should be in its place. I see sometimes things are not in a proper place. We have to have a good system of arranging the things, and involvement involves maintenance of records and reports also. We need to file properly and see that case sheet is done properly. There are general rules. Those are general rules, can be done by anybody. There are specific rules and assessment of patient's nursing need, planning and providing of nursing care, prevention of complications. For example, if there is a Riles tube in the nose, I think that after surgery, next day I come and see the usual complaint by our usual presentation by residents are, sir, Riles tube is nil. How can it be a Riles tube is nil when a major surgery is done? When a major surgery is done, for 48 hours or sometimes more, the intestines doesn't move depending upon the surgery. If I do a small intestine surgery, it takes more than 6 hours to move or peristalsis. So what happens to the secretions in the stomach, in the pancreas, in the duodenum? So almost 3 to 4 liters of secretions will be there. Where does that secretions will go? So it means that we have not properly placed Riles tube. It means that we are not properly aspirated the Riles tube. So what are the consequences of this? Consequences are, there is a lot of pressure on the anastomosis. Wherever we join the intestines or stomach, there is a lot of pressure on that. Due to that, the stitches will just give away. That's why we see a leak. Suppose we do a Whipple's major pancreaticoduodenectomy, there's so many complex anastomosis are there. If the Riles tube is not properly aspirated, or if the Riles tube is not properly placed, and then what happens is a lot of pressure on the pancreas and anastomosis, so it will give away. So that we don't want. Once there is an injury to the hand, what will we do? We'll just hold it like that. It means we give a rest to the arm. So rest, if there is no rest, like similarly if there is a stomach operation, we'll give a rest to the stomach by putting a Riles tube so that all the fluids are aspirated. So we need to give a rest to the stomach and other intestines. So that's why we have to prevent the complications. You are the main person to prevent the complication. Of course, being a surgeon, I'm a responsible person, but at your level, see that the kind of complication doesn't. For example, another one, drain is there. So patient may have a bradycardia, hypotension, but our residents will say, sir, patient has bradycardia and hypertension, but drain is nothing. Obviously, the drain is blocked by the blood clot. How do we know? So we have to examine. Unless you examine, unless you have to get that thought, why there is no blood, why there is bradycardia, why there is an hypertension. Probably there is a blood clot which has blocked the tube, and the blood is collected inside. So we have lost that 1 or period. So patient may go into hypertension and shock. So we have to be very careful. Documentation of care provided to the patient. Everything, documentation is very, very important thing for anybody, any medical professional, not only the nurse, for all, because the document should speaks for you. After 10 years, if I take out the case file, it should speaks for you. Okay, this patient had a treatment, this is the kind of treatment. So documentation is very, very important. And assist hospital administration is in measurement of the performance. Infection control is another very big important issue in the hospital. I'm sure next speakers will speak all those things. Patient care, providing optimal care to the patient, comfort and well-being of every patient, concerned with carrying out of medical treatment, helping the physician in carrying out some of the major procedures or minor procedures, and giving medicines and carrying out treatment, observing nutrition of the patient. This is a very important thing. Most neglected thing in treatment of the patient is the nutrition. I means a doctor, nurse, we will not bother about the nutrition. All the patients, you go today and talk to any patient. The first thing they'll ask is, sir, what should I eat? Everybody will say. Then we'll say, okay, have liquids. What kind of liquids? Next question is, what kind of liquids? Is it simple water? Is it a coconut water? Is it a fruit juice? They'll have multiple questions on the nutrition. They'll ask definitely the day after the surgery, or in a patient who is there in AMC or in ICU, they'll ask one thing, what food should we give? However, you explain, this is the most neglected part by the medical profession. I'm not saying nurses, saying doctors also. Next day of the surgery, they'll come and ask, sir, what food we should give? We'll say, for 4 or 5 days, please don't give anything. Again, after 1 hour, if you go, they'll ask same question. So we are not, because they do not know that how much IV fluids will give you calories. They do not know how much dextrose will give you calories. They do not know how much DNS will give you calories. So that's the reason why they'll ask. So we should explain them why we are not giving. You are the best person. And interventions. Example of some of the interventions, I'm sure you all know. So you tend to, sometimes you may have to feed them. Yes, if the patient in ICU, especially in neurological ICU, we may have to feed them. So that is also one of the procedures. And postpartum, sometimes you may have to support, bedside care and assistance. Everything comes under all these things. Nursing intervention, the categories wise, independent and dependent and interdependent. Independently, you can do many things. As in a nurse, you can perform independent procedures like routine nursing tasks, checking vital signs, giving drugs. All these things can. So dependent, some of the actions you need to talk to a doctor and then find out what kind of things we have to give. Interdependent. So we need to do some certain interventions along with other disciplines or other team members. The role of assessments, nursing assessment is the first step in the nursing care plan. So as I said, vital signs, physical complaints, you have to behave like a doctor with a patient. You forget about the doctor, let him come and go, but you have to behave like a doctor with a patient. You talk to them like that. So they should forget a doctor, because you are the person who is going to stay with them for 8 hours or 12 hours, whatever it is. So you have to address all the complaints they have, and external body conditions, medical history. You talk like that. You take a history. You do whatever you want. But as I said, there are certain things independently you can do. Certain things you can just follow your doctor's advice. Certain things with other disciplines. So what are the nursing interventions to perform each shift? Pain control. So most problem always is the pain. Some of them will tolerate pain, some of them may not tolerate pain. So you need to control the pain by giving an adequate analgesics. The position changes. This is most important for any nursing care. So we used to see when we were students, there's so many BSc nursing, GNM nursing basically. Their duty is to do a lot of head care, hair care, nails, and then position, nutrition, everything is to do. Probably over a period of time, someone else has taken over that. So I think we need to do that. Active listening is most important. Doctor may not listen. I'd say always, I'm saying my weak points. So that should not be your weak points. That should be your strong points. You have to listen to them. You have to listen to them. N number of times they keep complaining. So cluster care, fall prevention, adequate oral intake. You have to find out whether they have taken adequately or not. So I'm keeping a lot of photographs of our hospital only. It means that all these things are being happening in our institution. So we need to only raise our bar and say, yes, we are also doing all these things. Progressive patient care is also very important. What are the elements of the progressive patient care? Intensive care we have, intermediate care. So all the wards have been divided like that. So intensive care unit, there will be more ward. For example, Krishna is here, he works in RSU. There is a lot of workload is there in intensive care units. So you need to take care of the central line, you need to take care of the arterial line, you need to take care of the ventilators, you need to take care of everything. I will give us 2-3 examples. This is, since it's a closed meeting, things happened adversely because there's a tubing behind the ventilator. The tube was blocked. Our tube was blocked by mucosal flux. Simple things, but we have seen bad results with that. So you need to be very careful. Self-care, and some of them after the surgery from the intensive care unit, they want to go to the toilet, but you need to help them. You need to take care of them, otherwise just they go and then fall. This is all happening. And I have seen once central line the knob was off, and then there's a lot of bleeding. So this kind of mishaps should not happen. These are all very serious problems. We have to be very careful. So especially when the central line is there. Central line, management of central line is very, 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 very important. So you need to take care of the central line. So nursing executive, some of the hospitals have a role of nursing executives. So they design and provide the nursing care by allocating sufficient numbers of nursing manpower for the patient care. I know this hospital lack this. We do not have sufficient. We need to have sufficient nursing care, especially in intensive care unit and all those things. We need to organize nursing audit also, implementing latest advances for nursing care. All these things are very important. Education like this are very important. So we need to upgrade ourselves and would like to learn. Maintenance of equipment and supplies, it's also one of the nursing important duty. So we need to maintain, suppose for example patient had sudden cardiac arrest, we have to have whether defibrillator is functioning or not. I have seen sometimes when we thought of using a defibrillator, there are no batteries. So in emergencies, I have seen a patient had a massive GA bleed. I wanted to intubate, but suddenly there are no batteries in the laryngoscope. So these kind of things we need to take care. Once in a week at least, check whether these are all working or not. So how can we promote a safety? So monitoring communication is also very, very important. Communication, you can solve 60 to 70% of the problems by just communicating with the attenders and patient. And they come and tell us, sir, akkada nurse unnarandi, enta baga chuskunnarandi. She is like a mother for me. These are the kind of words we heard. So they'll be so faithful, they'll be so happy if you take care of them really. Patient education. At the time of discharge, you may have to speak few words saying that this is what it's done for you, this is what is going to be done for you, and this is your disease, and this is the problems you're going to have. Please explain. 5 minutes, 5 to 10 minutes, they'll be very happy. So what we need is lack of time. We do not have much time to talk to them. So this is very, very important. If any institution is getting a name, it's not by treating and serving, it's also by counseling them, by talking to them is very important, educating them. So how does nurse staffing affect the patient safety? This is several factors it implies: complexity of the patient condition and level of the care they need, the number of admissions, discharges and transfer, skill level. So there's so many things we need to discuss. I'm sure over a period of time in next few hours we are going to learn all those things. The impact is so much that there is so much of impact on the patient safety. If we follow all these rules and regulations, the patient will improve faster. The mental stability, mental strength, if you give to the patient, I'm sure they'll come out from any kind of trauma or any kind of injury or any kind of surgery. So how nurses influence patients' outcome? It's one of the most important thing is you have been asking and everybody has been asking. Nurse to patient ratio, yes. In India, it's very, very difficult to have this ratio. It's very, very difficult. In fact, we have to have in intensive care unit, we have to have almost 1:1. So in general wards, you may have less. So this nurse to patient ratio is definitely very important. I am going to seriously look into all these things. Workload is very important. We have the amount of workload we take is enormous. I may say admit this patient, sister, admit this patient, take care of this patient, take care of this, but the workload is definitely high. But we have no option. Ours is India is the highest population country in the world, so we may have to face difficulties. Shift length, yes, we have to certain hours of shift length. Leadership, yes, that's also we need to encourage. So long shifts actually should not be allowed. 12 hours, it's tiring for anybody. So we need to cut down that. We need to have some rest. If a nurse is working for continuously for some time, yes, they need to be given off for some time so that they come back with a lot of energy. So these are all important. Changing schedules, we need to upgrade, yes. And emotional involvement with the patient is important, but to certain level. We should not go beyond that. I'll tell you an example. I had treated one old lady, 60-year lady, 670 probably, who is a diabetic. She had a gallstones, and she is wife of one class 1 officer, very nice lady. And I operated. They were shouting at her a few times. I said, why are you shouting at her? She wants to eat this one. Please give. Sir, she is a diabetic. It's okay. We'll give 2 units of insulin more. Why are you shouting at her? So like that, I counseled her four or five times. And then at the end of the day, at the time of discharge, she asked me my phone number because I had become a little closer to her. Her name is Krishnavedi. So I became close to her. After discharge, she started calling me. Then I said, okay, tell me, Amma, what are your problems? Initially, nobody will refuse. Nobody will say blunt. Every day, morning and evening, morning and evening. And then she came for a follow-up with her husband. First 2-3 times she came, there was some wound infection was there. Then after that, she came alone. And she started asking me, let's go out. I was shocked. At the age of 60, and I'm 59 or something, and she asked me, let's go out. I said, what for? Let's go out for having a dinner. I said, no, I'm sorry, I can't come. And then she started calling me again. I blocked her number. And then landline, she started calling landline. Gautami, our secretary there, she said, Krishnavedi ante evaru phone chestunnaru sir. Ivandi phone chesi, entamma, I want to see you. So why do you want to see me? So then she just came 2-3 times to the OP, and finally I have to complain to her husband. So emotional attachment should be there, but not this much. So very dangerous sometimes. And Recently she passed away. Husband called me and said she passed away. Anyway, so they'll have some of the demands they may have to have, so we need to very careful. So another important thing is we work with the patient. We work with an environment where there are a lot of bacteria are there, a lot of viruses are there. So we have to take care of ourselves. We have to take care of our families. We should not carry bacteria virus to our children or our home. So be careful. Protect your hands with the gloves and goggles or whatever it is. So take care of your health is also very, very important. Unless you are good, you will be fine to treat any patient. So PP, kit, whatever, you take care of all those things. Changing technology, as I said, you need to upgrade yourself. When now new instrument is coming, you need to ask doctor, please let me know what kind of instrument is this and all those things. So upgrade yourself is also most important. So poor treatment from patients, it does happen sometimes. మీరు ఎంత కష్టపడి ఎన్ని ట్రీట్మెంట్ ఎంత ఇచ్చినా కానీ పోయేటప్పుడు 4 తిట్టేవాళ్ళు చాలామంది ఉన్నారు ఈ మధ్య కాలంలో. సో యూ షుడ్ నాట్ బాదర్, డోంట్ టేక్ ఇట్ సీరియస్లీ. అదేదో వాడు చేస్తాడని అనుకొని ఉంటే బెటర్ అది. సో లెట్స్ నాట్ గెట్ డిస్టర్బ్డ్ ఇన్ దాట్. సో లెట్స్ సే ఓకే ఫైన్, థ్యాంక్ యూ వెరీ మచ్, ఇఫ్ యూ హ్యావ్ నాట్ ట్రీటెడ్ వెల్, గాడ్ బ్లెస్ యూ అంటే అయిపోతుంది అది. లెట్స్ నాట్ పుల్ ఇట్ లాంగ్. So thank you very much. I thank Swarnlata for giving me this opportunity. So hope we all learn. I'm not saying you learn. We all learn. We all become experts.